So we are Dan Bilsker and Merv Gilbert. We're psychologists, and we're going to be talking about a project we've been working on for the past several years, which is to find user-friendly and effective ways to help paramedic services workers become more psychologically resilient when you're facing the kind of occupational stresses that are just an integral part of the work.
Um, I am Merv Gilbert. He is Dan Bilsker. We're not Merv Gilbert, Dan Bilsker, just to clarify. And for the last, 15 years or so, Dan and I have been working with a variety of organizations, a variety of sectors, particularly healthcare, because that's where we're both from, on creating and supporting psychological health and safety in the workplace. And what we've learned through that, and through a lot of experience, good and bad, and so on, it's important to come up to interventions, tools, and so on that fit the particular organization that you're working with, so on, that actually comes from the workforce rather than taking something off a shelf where it's not likely to be relevant, not likely to be used.
And another priority we've had in this project is to learn from the people who are working in that setting, to use what we call the acquired wisdom about how to be resilient in coping, to learn that from individuals in paramedic services. Paramedics, dispatchers, call takers have a lot of acquired wisdom about how to cope successfully. We've tried to learn that from them and share that with everyone else. That's been a major priority for us.
So in order to customize, to build something that's relevant and useful for BCHS, we talked to people. We created a survey, sent it out to the entire workforce. You may recall receiving it at some point, asking questions about resilience and coping and stresses and so on. So you get a picture of that. We also interviewed people in remote, urban, and rural settings and so on to get a sense of what the experience of dispatchers and paramedics were in that context. So based on that, we got a whole bunch of data, of information, some of it numbers, some quantitative, some of it, and very valuable, qualitative, in other words, comments and suggestions.
And one of the critical aspects of this project is that it's a collaboration between BCEHS, the employer, between CUPE, the union, the University of BC has been involved, and it's been funded by WorkSafe BC. So we have a number of critical players who are collaborating to do this together. Out of this analysis we've been talking about, out of all the interviews and the survey and so forth, we came out with 5 critical resilience factors. These are key elements in being psychologically resilient in the high stress environment of this kind of emergency health services work. Won't go through this in detail, but one of these is called balance between your work and your personal life. Another refers to self-acceptance, not judging yourself harshly when for various reasons you can't meet all the goals you've set for yourself in your work. Another is called meaning in work. It's a consistency between your own values and the work that you do and maintaining that over time. Another is trusted social support so that you have and maintain other people around you to whom you can speak, whom you trust, and who have your back. Another is called physical self-care, and that's maintaining your own physical function through nutrition, through fatigue management, through exercise, etc. It affects you psychologically. So out of all that work came a workbook, the 5RF workbook. That's a way of transmitting and sharing what we've learned, transmitting these skills and knowledge in a very easy and user-friendly way. It introduces psychological resilience. It gives you practical skills. It shares wisdom from other BC Emergency Health Services personnel. It shares it among all of you. And that book is available. It's available electronically through a free download. It's a link that would have been sent to you in several forms and will be sent again. And it's available on your request in a physical hard copy, which some people find more engaging. We've made it available. We want it out there. We strongly encourage you to check it out. Get a copy, one form or another, and check it out and see what in that is relevant to you and your peers.
What we've learned in our experience to date is you can have a very good program, but all too often they sit on a shelf. So there's a real challenge in getting things like the 5RF workbook out to the end users, to the audience, to you. So to accomplish this, in addition to providing it as a PDF, a link, and a hard copy, we're also talking to various groups. We've had conversations with your EAP providers about the workbook. We've had lots of conversations with the CIS and peer team who've been wonderfully helpful. And the team has the copies of the book, as do the counselors, psychologists that work with you. We've talked to new recruits. We've talked to chiefs. We've got an ongoing set of meetings. So our ultimate goal is that this workbook is useful and practical for you and your colleagues whenever you may need it. And it belongs to you. It belongs to your organization.
Thank you for listening to us, and please check it out. Check out the book. See what you think. Thank you.
Take care.